When I was actually hired here, I was hired as a family therapist, and then with the understanding that I could work in some art therapy into the programs. And within 6 months, they basically let me create a whole standalone art therapy program. The individual work is what I really, really love. And so being able to kind of pull people that you find are extra responsive or could maybe use some additional support and create an art therapy directive that supports their treatment plans has been incredibly helpful for me, and I think has been really helpful for a lot of the patients. I actually have a process where I can do what's called an art therapy assessment. That's usually 3 to 5 pieces of art, and there are just specific things that I'm looking for in terms of like coping skills or family relationships, even resilience or like self-perception, and then can actually write up a full assessment from that and come up with a plan with the patient. I've learned it's really important to involve the patient in that process and not just make assumptions. A lot of art therapy is, like, the emphasis is on the process and not the outcome. And so allowing patients to let go of expectations and just get lost in the process and just be present, just be mindful, and that it doesn't matter what it looks like. I always tell them they can trash anything they want to before they leave the room, but just to have the opportunity to get out of their own way and create. It tends to engage the brain differently and kind of distracts from the fact that they are opening up and talking so much. Many times I've had people say, "Oh, I'm shocked that I'm telling you this," or "I can't believe that, that this is coming out right now." But I think that it engages the brain in such a way that it feels that it's occupied and we have less judgment and just a more direct route to expressing ourselves emotionally. It takes the pressure off of trying to find the right words. There are Kleenex boxes everywhere, and I'm always a little afraid people are gonna run screaming when they, I try not to warn them that it will be as emotional as it can be, but it can definitely bring up a lot of stuff. It can definitely be very emotionally evocative. To see someone become truly affected and really get into their feelings, or just be moved by the process. Even if it's just that they're present in the moment and for that hour have kind of let go of that like overthinking, self-criticizing, worrying about what's going on outside of here that they can't control. So even if it's just to keep them present for that hour, then great, fantastic. That's exactly what they needed to take away from it. I love like having them consider like texture and using found materials. I think it's really important too to make art approachable in a way that, it's something that they can create in their garage when they get home on a piece of cardboard. It's not something that requires a lot of money or requires an art studio or anything. I'm incredibly grateful just that I get to do what I do and connect with people in such an intimate way. I find that I end up tearing up and crying with the patients pretty frequently, maybe more than I should admit to. But it's just such a powerful relationship that gets formed in something that can be incredibly intimate. Like the creative process is just incredibly intimate. You're creating something from nothing or from trash or from, you're taking risks. You're showing yourself in a way that's very different. And it's just a really moving thing to experience someone that has so much courage and willingness to be able to take a risk and do something like that. I've learned, to kind of work from a place of gratitude.